Solidarity forever. Solidarity forever. Solidarity forever. For the union makes us strong.
Members of the Fourth Estate, my name is Dr. Abi Mwachi. I'm the National Chairperson of the Kenya Medical Practitioners, Pharmacists and Dentist Union. With me today, I have the executive branch of the of the KMPDU Central Branch, and we are just from a meeting brief that has resolved that the strike in Kiambu, which started yesterday, continues. This has been given buoyance by the court ruling today that Kiambu County is known for its belligerence, for its lackadaisical attitude when it comes to labor matters. The strike of Kiambu was occasioned by the inaction by the Kiambu government in resolving the issues affecting doctors in that particular county. Kiambu has approximately 500 doctors in the public service, most of whom are resigning because of poor working conditions. As a matter of fact, Kiambu has the highest resignation rate of doctors in the country, in the Republic of Kenya. Secondly, the second medal that Kiambu boasts of, with a very distant second coming in contention, is that Kiambu has the highest number of doctors either undergoing rehabilitation or already admitted because of drug abuse and alcoholism. Kiambu County has perfected the art of running against the tide in as far as labor matters for our doctors is concerned. Our doctors have been working for years on end, and to give a particular example, the doctor who's worked 14 years at the same job group, almost going into retirement, and there's no job progression despite the county being all too aware of the return to work formula that we signed last year that was occasioned by a 56-day strike. Kiambu is not moved by those things. Kiambu has better things to do. Kiambu has better things to offer the people of Kiambu other than healthcare. They have money to do everything else other than to provide quality healthcare. 23 new brick and mortar white elephants being built, but there is no money to hire specialists at the specialist remuneration level. That to say that our foremost grievance with the county of Kiambu is the lack of promotion of our doctors dating up to 10 years back. The second utmost grievance is that Kiambu doctors has also resulted in punitive actions for doctors who raise questions as regards to their workplace. That is lack of proper equipment, lack of medical cover. When a doctor raises such issues, they are transferred arbitrarily. A single doctor has been transferred up to 5 times within 6 months. And whenever they go to another facility, they tend to meet the same particular grievances that they left in the facility that they left. And then when they raise those grievances, they are again transferred. There has been a draconian arm by the Kiambu government that has tried to politicize the running of healthcare in Kiambu. This was seen during our notice of strike action, where senior county officials went onto the media and started saying that the doctors are going on strike because of politics. I want to tell you that doctors are professional bodies, are professional individuals. They are averse to politics. They do not see politics. They do not hear politics. They do not speak politics. We should be left as doctors of Kiambu to do our work, and that is to treat Kenyans. Let me also point to a very unfortunate event in the Kiambu County health workforce and the personal labor relations issues. It is bizarre and abhorrent that we are fundraising for doctors in Kiambu every month because of medical expenses. A farmer in the pineapple plantation of Del Monte does not starve of hunger in the farm. A waitress in a low-caste hotel of cafeteria cannot ask for friends who are at home to fundraise for them to get lunch. But in Kiambu, the doctors who are working in those hospitals cannot even afford the services that are offered in those particular hospitals. And are they offered those services for free? No, they're required to pay like any other individual. Then there's a arbitrary transfers, a matter that I've alluded to, and the draconian arm of the political wing of the government that has threatened doctors so far to an extent that we have been threatened this morning from issuing a press conference within the precinct of Kiambu, and that is why we've resorted to issuing this press briefing in Nairobi. I think the chairman will add a thing or two, then we can have the rest of the members. I'll recap it in Swahili.
We are happy to report that our strike is protected by the court now. Our people should feel, our doctors should feel free, because our aim is to make Kiambu better. We want to make sure that every patient of Kiambu gets services from doctors that are comfortable. We are tired of burying doctors because of burnouts, and also taking care of alcoholics who are brought about by poor remunerations, poor work relationship, actually toxic work environment, where one does not know what he is expected to do the following day. We have been used to getting transfers every Friday, which means that there's no growth in the county. No doctor knows what he is expected to do the following week, because they are ever waiting to be transferred to the next point. These transfers, if those who have read the scheme of service, those who have read human resource manual, they know so well that there's a budget attached to it. So we are convinced that the reason why these transfers are done every Friday, there must be somebody who is taking money on behalf of the doctors that are being transferred every Friday. There's a transfer allowance which is supposed to be there, and there's baggage allowance which is supposed to be there. Having said that, I want to advise our people of the neighboring counties to sympathize with our patients from Kiambu, because they'll be seeking services from them. They'll be coming to Nairobi, they'll be going to Nyeri, to Muranga, and even those who can go to Nyeri, they can. And they'll be going to Naivasha and Machakos, because those are the counties that we also serve when all the doctors are working. So with that, we want to say that our doctors are going to remain out until all the issues have been agreed upon. We have been in the consideration process, of which Kiambu County refused to come, simply because everything was as usual. It was business as normal business. But now it is not business as usual, and therefore we are expecting them to come to consideration. And once we have agreed on everything, we are interested to go and do our business. Our business is only one: to treat the patient, to improve the health of Kiambu, and to promote Kiambu by all directions. Buildings will not do that, but we need all our doctors to be allowed. Those who want to go back to school should be able to go to school and further their education. We are tired of sending people to other countries for management when we have people who can be able to do it in their own country. Thank you very much.
It's the county that has gone on strike on you. And what we as doctors have decided to do in this period is to reorganize how we will run healthcare for the people of Kiambu during this period of industrial action. And therefore I want to announce the following things, and I hope I'll be clear enough so that there's no confusion on the ground. We have rolled out effectively yesterday midnight minimum service provision of services across Kiambu County. This program shall look as follows. All hospitals in Kiambu shall be closed. There shall be a doctor at the casualty or the emergency department of every hospital in Kiambu on call to stabilize any emergency for any person within Kiambu that shall come. Such patients shall be stabilized, and if there is need for further stabilization, shall be referred to Thika Level 5 Hospital and Kiambu Level 5 Hospital. These are big hospitals within the county that have registrars, which are doctors in training from other counties. The work of those doctors will be to further try and stabilize the people of Kiambu and then refer them out to hospitals outside the county. We also have today started discharging any patient in the ward that is not a critical case. This is because as doctors are on strike, we cannot guarantee care for patients in the ward. The only patients in the ward that will remain as of now are patients who are critical, and as soon as they are stable enough to be discharged, they shall be discharged. All the patients in the ICU shall remain in the ICU, and our doctors in ICU shall continue to attend to them. All other services that are not essential, be they clinics, be they rounds, be they other pharmacy, dental procedures, shall not be conducted in any hospital. And therefore, to the people of Kiambu, we are taking these measures to balance a rogue county government that has completely abandoned working on healthcare in the county, and also the emergency needs of the people of Kiambu. That's why we are going to go on a strike like no other. We will completely shut down Kiambu County, and at the same time, we shall take care of any critical cases that there might be. And therefore, to the people of Kiambu, please contact your member of county assembly. Ask them to intervene in this matter. The shorter the period of the strike, the better it is for everybody. And let us work together to make Kiambu healthcare great again. Thank you.
I would like to inform the members of the public that it's time to care for the carers. Our doctors are hardworking, our doctors are professionally trained, and we therefore demand decency at the workplace. We demand dignity, restoration of dignity at their workplace. We cannot continue working any longer more than 40 hours per week, being denied leave, and our seniors being threatened if they offer the doctors leave. These are basic human rights, and these are enshrined in the Constitution. Thank you very much.
Of this month, that is 3 days before the expiry of that notice, they are going to court to get an injunction stopping the industrial action that was supposed to happen today. And they were not given those injunctions, and despite being given a fairly balanced hearing, they chose to serve us at 7 p.m. last night for a hearing that is meant to happen this morning. That even explains why we are late here, because you're working round the clock, burning midnight oil to respond to the court servings that we were given at 7 p.m. at night, which we have adequately responded to, and a ruling has been made this morning. The strike continues.
Are we going to see doctors taking to the streets?
While I may not guarantee anything at this point, this is just the launching pad. As you might have heard from the branch secretary, Dr. Bill Morioki, that we have even been magnanimous in our action to set aside minimum working operations in the hospitals on a humanitarian basis. Nothing is ruled out at this particular point, because doctors right now, we have come out from the cocoons of Bogasi. Doctors have joined the cohort of the proletariat, and we have demonstrated before in Nairobi, and we can do the same in Kiambu, and take the message in clear tone and tenor to the county government offices if they do not listen within a few days. Questions at this point. Just to remind you that Kiambu County is a focus of the National Office, KMPDU, because it is the second largest county in terms of